It's another impact of the pandemic not seen in the numbers of those infected or who have died from the virus. The children left behind when a parent or caregiver is taken from them. KSHB 41's Dan Cohen looks at how COVID deepened an already dire situation.
Jackson County's court-appointed special advocates work with children impacted by neglect and abuse. But in the past 2 years, CASA has seen another concerning trend.
Serving these kids, we have had children and families that we worked with where the kids lost their caregivers due to COVID. So we know that nationally, the numbers are pretty dramatic.
The Imperial College of London has been tracking COVID-19 orphanhood in the United States. There were about 2,500 orphan kids on April 5th, 2020. A year later, more than 100,000. The most recent available date, April 5th, 2022, shows slightly less than 200,000 children in the U.S. who lost a parent, guardian, or caregiver. The ripple effect is severe.
They're more likely than their peers to engage in substance use. They are more likely to drop out of school. They're 2 times more likely to commit suicide than their peers who are not orphan.
Jackson County CASA says they were able to serve 1,250 kids last year across all circumstances, but they couldn't reach all 2,700 kids in the welfare system. In Kansas, Johnson and Wyandotte counties are only able to serve a third of youth under court protection.
We are still seeing the effects of COVID in the children and families that we serve, and certainly in the number of cases that we are seeing. So we need more CASA volunteers.
Even as many return to a new normal, those orphaned by the pandemic have to confront a new reality.
There's no chance for reunification, and that can be devastating. And that's why early intervention is so important.
In Kansas City, Dan Cohen, KSHB 41 News.